Khensani, good morning, and thank you very much for your time. First up, I mean, there's been some reports that a staff member in one of your centres might have tested COVID-19 positive. Can you confirm that?
Yes, Dan. So we have had a member of our staff that did test positive of COVID-19. The donor immediately notified us as soon as she received her test results, and she was isolated. Everyone around her was traced, who was possibly in contact with her, and they were also advised to follow the necessary steps to then isolate themselves and monitor for symptoms. So right now we have not received word of anyone else who's been infected. We're monitoring everyone, and we will provide an update should there be any changes. However, everyone's still safe, and we have not received any word of anyone developing any symptoms.
Okay, Khensani, just for clarity, there was a blood donation being made, and that blood was tested, and the donor was found to be COVID-19 positive.
No, so it was one of our staff members who were found to be positive, but they had been around specific donors as well as their colleagues around the donor centre. So everyone has been traced successfully, and they have all then been given the proper steps to follow in terms of self-isolating and monitoring for symptoms. And we're providing support to everyone who was in contact with the donor as well as our staff members, and we're just monitoring the situation at this point. Excuse me.
Okay, how many people are we talking about here?
So it would be anywhere between, I think it was between 20 and 30 people. We're still then just monitoring everyone, but I think we are confident that we have traced everyone.
Okay, you're confident you've traced everybody. So the staff member is in isolation, and the other between 20 and 30 people have also been found, and they've been advised accordingly to take the necessary precautions. And you are satisfied that everything you've put in place there is correct?
Yes, that's correct, Dan.
Okay. Now, this might make people really not come forward to donate, because when they hear the news that maybe in one of your centres you had a positive case, how are you approaching that? I mean, are you seeing people coming up or not? Because we do need blood donations.
So the nature of blood donation is inherently carries the risks of transmission, I think. So it is definitely a contact situation. So we cannot avoid any infections altogether, Dan, but we have then taken necessary precautions, and I think we did extremely well to ensure that no infections did take place over a period of 5 weeks. We have strict infection prevention controls at each of our donor centres, fixed donor centres as well as the mobile donor centres. So we make sure that everyone our staff specifically are wearing visors and masks as well as their gloves and aprons. So they screen all the staff members at donor centres every day. We also make sure that we screen all the donors. So we give them a questionnaire that they fill in, and then when they come in, we wipe down all the surfaces. We make sure everything is extremely clean, and we maintain strict social distancing measures. So over and above that, I think we encourage our staff to also then make sure that they watch out for symptoms from their donors as well as themselves. Any and all symptoms are taken seriously from us. So we do as best as we can.
Yeah, Khensani, are you confident that all of what you've just explained will mitigate the risk that is now in existence for your blood service after this COVID-19 positive case and affected between 20 and 30 people has happened? Are you confident that the measures you have in place now will be sufficient and will rebuild trust?
Yes, I think we are confident with that, Dan. As I said, it kept any infections at bay for a good 5 weeks. I think the situation is currently, it's constantly changing in any case. So we have to then just ensure that we stay on top of the situation better. We have advised actually our staff to just ensure that they're a bit stricter in terms of their own self screening, just to ensure that then our donors are protected. But we have had an incredibly overwhelming support from donors.
Okay,
so
that's
far.
good. That's good to hear. Very briefly, before I let you go, Khensani, it's good to hear that you've got an overwhelming response that still supports the blood service, because that the blood is very much needed. Just very briefly, has the service provided PPE to its employees in all the centres to make sure that they comply with the measures you've put in place now?
Yes, that's right. And they have visors as well as face masks that they have to actually don at all times. They have aprons and gloves as well. They have also been trained extensively on the correct ways to wear the PPE, and as well as disposing of it. So we're confident that they're protected.
Thank you very much. Khensani Mahlangu speaking on behalf of the South African National Blood Service.